Okay, so let's talk about plantar fasciitis. Probably almost everybody has heard of it, probably known somebody that has had it, or you've had it yourself. It's the most common cause of heel pain that I see. There's 2 million people a year that have had it. And so let me talk about my experience with it as an orthopedic surgeon that's an expert in foot and ankle. And so this is the foot, it's the bottom of the foot. And you can see here that there's this normal thick band of tissue that runs from here. And this model doesn't quite show it correctly, but it goes all the way to the toes. And it's not a ligament, it's not a tendon, it's something called fascia. Fascia is just a thick, fibrous connective tissue, and it connects from here to here, and it actually has a very important purpose to help support the arch. And so this plantar fascia actually has an important purpose, not only to help support the arch, but it shock absorbs. So you can imagine when you put weight on it like this, it kind of will stretch and contract, stretch and contract like that. So it has an important function. Now that you're familiar with the anatomy of the plantar fascia, what causes it? Well, this little band of tissue here can take up a lot of stress when we walk. And so it's not uncommon that it can get irritated. So the risk factors for getting it is obesity, repetitive high impact activities like running, high arches can cause it, and a tight calf muscle can cause it. So that being said, the vast majority of people that come and see me are none of those things, don't have any of those risk factors in the way of being obese or have started any running program or are runners. They just one day got out of bed and started having it. So when you come into my office, the first thing we'll do is get an x-ray. And that will tell me about the shape of your foot and see if there are any other abnormalities. So one misconception that I want to debunk right now is this concept of a heel spur. So on x-rays, lots of patients have a heel spur right down here. And lots of patients even come and see me and say, it's a heel spur that is causing me pain. And then they'll see it on the x-ray and they'll be, see, I knew it was a heel spur. And I have to explain to my patients that the heel spur is not the source of the pain. 1 in 10 people have a heel spur, and only 1 in 20 actually have any heel pain. So 5% of patients that have a heel spur have any pain. So it is not the solution. And when we talk about the options, when we even have to do surgery, and luckily 95% of people get better, 5% need surgery, and even when we do surgery, we do not even mess with the heel spur the vast majority of the time. So after we get an x-ray, we'll review that. I'll usually have to give my patients the talk about the heel spur is not the source of your pain. And then on physical exam, what I'll do is I'll have them stand. I'll see, do you have a high arch? Do you have a low arch? I'll have them walk. I'll see if they have any necessarily gait abnormalities. Then I'll press on their foot. And so when I'm pressing on their foot, I can almost always put my finger in one location right here. And that tends to cause a significant amount of pain. And so that usually gives the diagnosis away, but I'll also test to see if they have a tight calf muscle, a tight Achilles, because those can certainly be associated with developing plantar fasciitis. Okay, so the treatment. So I always tell my patients, like I mentioned before, 95% of patients with plantar fasciitis goes away. So you have pretty good odds that it goes away. And I always explain, listen, this is a biomechanical problem, meaning the tighter the calf muscle, the muscles in the back of the calf, the tighter the Achilles, the more stress on the plantar fascia. So let's go back, or let's rewind to a second where we talked about the symptoms that my patients describe. So you remember, we talked about the most common things they tell me is that they just got out of bed one day and it was there, right? With the startup pain is what we call it. And so they have that because what happens at night, or if we're sitting, or if we're in car rides for a long time, is our foot like this. That's kind of the normal resting position of the ankle. And so in this position, the calf muscle and the Achilles tendon get shortened. So you can imagine, if you do that for 8 hours, your Achilles tendon, your calf muscle is going to be very tight in the morning. So you get out of bed, those first few steps, you're going to be at your tightest, and it really yanks on that plantar fascia. So like I said, it's a biomechanical problem. The tighter the calf, the more stress goes on the plantar fascia. So you get out of bed, it hurts, and then as you start walking, most patients will tell me, well, it eases up. And that's because when that occurs, that calf muscle has sort of stretched out a little bit, and subsequently relaxing the plantar fascia a little bit. And so then the treatment for plantar fasciitis is geared on the biomechanical problem. So the treatments are, and if you read on the internet, there are a million treatments for plantar fasciitis, but I try to keep it simple. I say, do a few things for me. I tell them, the most important thing out of everything will be the stretching exercises. This addresses the root of the problem, the tight calf muscle, the tight Achilles, which subsequently yanks harder and tightens the plantar fascia. So we'll do physical therapy. There are some exercises on my website, footandankledfw.com. If you go under the patient resources, you'll find them there. And I tell my patients, you have to do those stretches religiously. It's not like most of us, when we have little aches and pains, we do our exercises for a few minutes and then we forget about it until it starts bugging us again. It's not how it works. You have to do these exercises every morning, afternoon, every evening, religiously. And the patients that do this, in my experience, are the 95%. The patients that don't do it are the ones that continue to have problems. And then there's just the 5%, the ones that just aren't going to get better regardless of what you do. But I see patients every day, every week, that have either tried their own solutions on the internet or own stretches, maybe even seen another doctor. They haven't got better with their treatment, and so they come to me. And so again, we'll start over and we'll do all the stretches and make sure you're doing everything right, because that is the solution. And if you haven't been doing it correctly, or you've been doing stretches once a day, it don't count. You just got to do the stretches, and most times it'll go away. The other things would be, usually I'll do a short course of anti-inflammatories that just helps with the symptoms, but it is not a solution. So if you take the anti-inflammatories, it'll probably make you feel a little bit better, but then it'll come back because it's not the solution to the problem. But some anti-inflammatories can help with the symptoms, so it's usually reasonable to do if the patient's it doesn't have any medical conditions that would prohibit it. Other thing I'll usually do is something called a plantar fascia strap, which is a little device that goes around the ankle and the foot to kind of lift up on the plantar fascia. How do we do this? Lift up here, and you can see how that will relax that plantar fascia there from yanking on the heel bone a little bit, okay? So that press up there, it'll relax it. And that takes a little bit of stress off the plantar fascia, and so it's not being tugged on so hard. There are, like I said, a million other treatments. You can wear a night splint. Night splint at night keeps your ankle like this. So by doing that, it keeps you out of that bad position like this. So it's fine. Night splint's okay. I don't usually recommend it too often because honestly, most patients don't wear it. They'll wear it for a few hours and then they'll throw it off and they won't be able to wear it because it's giving them a nuisance at night. And you know what? I don't blame them. I wouldn't wear it either. And so while you can find those type of treatments on there, you can do that. Now, if you have low arches, an arch support might be useful, and I like a full-length orthotic an orthotic, an insert that goes the full length of the shoe and is made out of a dense foam. That's my preference. I don't like rigid ones. I don't like plasticky ones. I don't like half-length ones. So full-length, semi-rigid arch support is fine. It doesn't even need to be necessarily a custom arch support. And what that will do also, same concept. It will kind of give you a little bit of an arch so it relaxes that plantar fascia. So those are all useful treatments. Now, there are other treatments. Steroid injections is a treatment option, but I really don't like them. Reason for that is they can cause a couple issues, and these issues are irreversible issues. So one is that it can cause what we call fat atrophy. So that steroid can kill the fat cells underneath the skin. Now, if it happens in other locations, maybe it's okay or tolerable. If that happens in the heel, that's a problem because you have to have that cushion, your heel pad here, to shock absorb. So to kill those fat cells would be a terrible thing. And you know what? There's no fix for it. The other thing that can happen is you can rupture your plantar fascia. And I see that all the time. So when that ruptures, it can be a terrible problem because you remember we said the plantar fascia helps preserve your arch or support your arch. And so if it ruptures, a very bad complication can happen. And that complication is it can collapse your arch. And you know what? Not good. Terrible. You can't fix it. You can't go in there and stitch the plantar fascia up. It don't work that way. So that can be a very bad problem if you rupture your plantar fascia and the arch collapses. The only way to fix that is for me to take a saw and cut your bones and rebuild you an arch. And I would not advise that. So one steroid shot might be okay, but the patients that are getting 2 and 3 and 4 and 5 and 10 steroid shots, I don't like it. I don't think it's good for them. But for the patient that comes in and says, "No, I really want to try it," I'll try to honestly talk them out of it. But if they want it, I'll give them the talk, give them the risks. And if they want to try one, I think it's reasonable to do. But still, it's not my preference. It's not my preference. So then I also tell my patients it takes time. Be patient. It ain't gonna go away overnight. It may take a few months, but the literature would show over 6 months, if you do conservative treatment, it'll probably go away, that 95%. So that's pretty good. So I usually give it a shot, and usually what happens is I say, just do it, do the exercises, do all of this stuff, and week by week, it'll probably get a little better. It won't happen overnight, and it'll happen slow, but it'll usually get there. And usually as you start feeling better, I say, okay, increase your activity with low impact, and then slowly get into the high impact, because I see a lot of runners and athletes, and they want to run, which I don't blame them, but I say just ease into it. If you keep on aggravating it while you're trying to get better, then it just circles, and then you don't get better. So what happens to the 5%, you're probably wondering? Well, your options are, number one, you can live with it, which most people that are in my office don't want to live with it. They're tired of it, so they want something done. But you could live with it if you just keep on having it. It just keep on causing you pain and difficult walking, but you can live with it. Nothing else bad's going to probably happen. Secondly, surgery. So there are multiple surgical options. My preference is what we call a partial plantar fascia release. So what we do is we go on the bottom of the foot, do a small incision like this. I don't know, what is that, a centimeter? Centimeter maybe. And we divide that inner third of the plantar fascia. See that? We just divide the inner third. And so what that does is it relaxes the plantar fascia, so it takes stress off of that area of pain. Now, an important thing with a plantar fascia release is you do not want to cut the whole thing, because we talked about your arch collapses with that, and it could collapse, and that's a problem. Again, saw to the foot, realigning the arch, not worth it. So just a third. We just do a third. It's like a 5-minute procedure. So if you go to YouTube, my YouTube channel, Dr. Sarang Desai, you go on there and you'll see a plantar fascia release surgery. So it's a minor procedure. It's maybe a 5 to 10 minute thing. It has to be done in surgery though. I guess it doesn't have to, but that's my preference, and that's most experts' preference. And after surgery, you might have 3-4 stitches. You walk in your boot afterwards for usually I say about 3 weeks. We take the stitches out. I usually get you out of your boot, get you into a tennis shoe. I say no running, no high impact, just walk around, work on some rehab exercises. Usually at 6 weeks, I say, okay, well, you can start easing into things. So again, low impact, bicycle, elliptical, walk, and then running. That can take some time to get better. I say, hey, it could take anywhere from 3 to 6 months to get better. There'll be little aches and pains. But the people that have the procedure tend to do very well. I've not had anybody over the 10 years or plus that I've been doing this that I've ever said, you know what, I have more pain, I wish I hadn't had it, those type of things. People tend to do very well with it. But like I said, it's good. 95% don't need it. My job is to keep you out of surgery unless all the conservative treatment fails, and that's the only option. So I hope this has been educational. I hope you've learned something about plantar fasciitis. I hope I've provided you some hope if you have it. 95%, go away, do your stretches, just do them. It'll go away, 95%. 5% won't, 95% will go away. Like I said, go to my my website, foot and ankle, dfw.com, and you can find some exercises on there. You can go to my YouTube, Dr. Sarang Desai, and you'll find it on there. You'll see the plantar fascia surgery. If you're one of those people that like the blood and that type of thing, like to just know what surgery would be like, that's cool. You can see it on there. And then my Instagram is Dr. Sarang Desai as well, and I'll post some stuff on there about just educational stuff. All right, so good luck, and if you have this problem, just stretch.